Even though I spoke some English back home before I came to the US, but as far as job prospect, it was hard. In the beginning, I was a dishwasher making below minimum wage, but still, you know, I managed to continue to get an education, to join the military, which helped me some, and to continue my career. When I was in respiratory school, one of my teachers said, if you cannot breathe, nothing else matters. And that's when respiratory therapy comes in to help the patient breathe better. I love everything about it because as a respiratory therapist, we get to go everywhere in the hospital. We get to go to all the ICUs, to all the floors, to the cancer centers. So we treat a wide variety of patients, pretty much from the newborn to the most geriatric patient you have. In the beginning of the pandemic, my dad was infected with the virus. That was back in March 2020. At that time, he went to the hospital. Unfortunately, it was so chaotic in New York. He didn't have enough care immediately. So 1 week later, unfortunately, he passed away. So my mother was also infected with COVID. She recovered, but unfortunately for her also, she passed away a few months later. At first, I was thinking, I've been in this field for 16, 18 years, helping people, and now I cannot even be there for my dad. So it was a little upsetting. And then with the help of my teammate over time, I took a different attitude. It made me appreciate more being a respiratory therapist or being in a healthcare and with the nurses, holding the patient's hand so they don't die by themselves. So I feel like somebody did the same thing for my dad. So it's encouraging me and my team to show more compassion, to our patients. I am hopeful for the future because we are knowing more about the pandemic. We are knowing more about the virus. We're getting better treatment. We got the vaccine, which is a big step. So I'm just hoping that more people will see the importance of getting vaccinated, and hopefully we can, see the end of this pandemic.